Good afternoon, and thank you very much for joining us this afternoon. I want to start with the usual daily report on the COVID statistics. The total number of positive cases reported yesterday was 1,281. This is 6% of the total number of tests. 496 of the new cases were in Greater Glasgow and Clyde, 258 in Lanarkshire, 194 in Lothian and 89 in Tayside. The remaining 244 cases were spread across 7 other Health Board regions. The total number of confirmed cases in Scotland now stands at 62,812. I can also confirm that 1,170 people are in hospital. That is an increase of 18 from yesterday. 83 people are in intensive care, which is a decrease of 3 from the day before. And I very much regret to say that in the last 24 hours, 28 deaths have been registered of a patient who first tested positive over the previous 28 days. That takes the total number of deaths under this measurement to 2,819. That figure reminds us again of the devastating impact that COVID has had and continues to have. I want to send my deepest condolences to all those who are currently grieving a loved one as a consequence of this pandemic. I'm joined today by the Economy Secretary Fiona Hyslop and the National Clinical Director Jason Leitch. In a moment, Fiona will say a few words about the close of the current furlough scheme and the new support that will replace it. The main update I want to provide today is about new guidance relating to schools and childcare, and I also want to say a few words about Halloween. Before that, though, I want to quickly draw attention to an announcement that was made last night. The Scottish Government has added 2 additional countries to the list of those that are subject to quarantine restrictions. Those countries are Cyprus and Lithuania. It means that from 4 a.m. on Sunday, people travelling to Scotland from these places must self-isolate for 14 days upon their return. This is a further reminder of how quickly levels of the virus in any country or area can change. And it underlines why we are continuing to advise against any non-essential overseas travel just now. Let me turn now to the main update for today. As the Scottish Government was preparing for our strategic framework, which was launched this time last week, we commissioned a piece of work from our scientific subgroup on education and children's issues. We asked for updated advice on safety within schools and childcare. Keeping schools and childcare open is of the highest priority for the Scottish Government. I understand that this is frustrating for other sectors who are having to close temporarily or to face restrictions. But I want to be pretty straightforward about the choice that we have made here. Bluntly, if we are to successfully suppress the virus and save lives, we cannot open up every sector and keep schools open at the same time. That is the hard choice we face, and we have chosen to put schools and childcare first. We've done that because we know that closing schools increases inequality and potentially causes long-term harm to children, and we are determined to avoid doing that. But we also know, because we saw this in March, that closing schools and childcare also closes massive parts of the economy. These 2 things are intrinsically linked. So based on our expert group's advice and also the recommendations of our Education Recovery Group, we are today publishing updated guidance for schools and childcare. The guidance is designed to ensure that these schools and childcare settings are safe for children, teachers, childcare providers, and for all staff. That is a fundamental and absolute requirement for the Scottish Government. There have been tremendous efforts applied by staff and pupils already to ensure that this is the case, and I thank all of them for their efforts. The guidance builds on their efforts and is informed by the latest scientific evidence, as well as people's real-life experiences since schools and childcare returned. And it takes account of the strategic framework and the new levels that it sets out. Now, there are a number of changes to the guidance, and I don't intend to go into the detail of each and every one of them, but there are a few points that I think it is important to highlight. First, the guidance includes new advice for adults and children in the shielding category. We hope it will provide further assurance and will ensure that they can stay safe. There are also a number of changes relating to face coverings in schools. Previously, Our advice was that adults should wear face coverings in schools if they were in contact with other adults or pupils for a sustained period of time. We are now advising that face coverings should be worn wherever an adult cannot keep a 2-metre distance from other adults and pupils. That applies at all levels, although there are some exemptions in relation to primaries 1 and 2. Careful consideration should also be given to hearing impaired pupils and children with additional support needs. Adults in primary schools should now wear face coverings in communal areas of the building, such as staff rooms, canteens and corridors. Previously, this advice only applied to secondary schools. And face coverings should be worn by parents and other visitors to schools, even if they are not entering the building. That includes, for example, when people are picking up or dropping off their children. Finally, in areas where Level 3 or Level 4 applies, secondary pupils in years 4 to 6 and their teachers should wear face coverings in classrooms. I realise that this recommendation in particular is a change from previous advice. However, the evidence suggests that there are slightly higher infection and transmission risks for people around the age of 16 to 17. So the use of face coverings is an additional precautionary measure in areas where there is increased incidence of the virus. None of the levels in the framework require any automatic move to school closures or blended learning. Any decision of that nature will be based on local dialogue and public health advice. However, the guidance makes clear that remote learning remains an important contingency should that be required. The updated guidance documents can be found on the Scottish Government's website. We've also published the updated scientific advice on which they are based. As always, we will keep the impact of these measures under careful and close review and update guidance if there is a need for us to do so. The guidance will apply from Monday, when the new levels come into effect. We recognise it will take time for all of the measures to be implemented, but we will work closely with schools, childcare settings, local authorities and trade unions to ensure that that can happen as quickly as possible. I want to take the opportunity again today to thank teachers, school leadership teams, childcare providers and other staff for their efforts over the past few months. I also want to thank children and young people and their parents for their forbearance. I appreciate how tough things have been, and I know that it won't be easy to adapt to further changes. However, we believe these additional measures are important. They will help to ensure the safety of everyone in school and childcare settings, and in so doing, they will contribute to our broader aim of stemming the current resurgence of the virus. The final issue I want to talk about today relates to the weekend ahead and specifically to Halloween. In ordinary circumstances, families across Scotland would be out guising tomorrow night, and people of all ages would be attending Halloween parties. Sadly, these are not ordinary circumstances. None of us at the moment should be visiting each other's homes unless it's for an essential purpose, and we should all be avoiding activities that make the spread of the virus more likely. I'm afraid that guising falls into that category. Going door to door, passing sweets, touching items others have touched, all of that gives the opportunity for COVID to spread. And if there's one thing we know, it's that this virus will take any opportunity it can to spread. So this Halloween, our advice is that you should stay at home. That does not mean, of course, that families can't have fun. Children and adults can still dress up and play games, and we can still all celebrate Halloween. We just need to do that in the safety of our own homes. That's certainly what my family will be doing. My son is already practicing some fantastic impersonations, and he's looking forward to getting dressed up. It won't be the same as other years, but we're still going to try to make it a very special night in our house. The Parent Club website has lots of great tips for having a fun Halloween, so if you're looking for ideas, it's worth going to www.parentclub.scot. None of us like the fact that these restrictions have to be in place, but sticking to them is really important. It will help to keep us all safe. So please, stay home this Halloween. Don't take risks for the sake of one night. It's really not worth it. In drawing my remarks to a close, I want to remind you of the general rules and the guidelines. If you live in Lothian, Lanarkshire, Forth Valley, Ayrshire and Arran and Greater Glasgow and Clyde, you should not travel outside those areas unless there's a clear need to do so. Essentially, these areas are in level 3 right now, and they will remain so when the new levels come into effect on Monday. At that point, Dundee will also enter level 3. So ahead of that change, I would encourage people in the city of Dundee and neighbouring areas to be extra cautious this weekend. Don't take unnecessary risks. Of course, none of us anywhere in Scotland should be visiting each other's homes right now, except for very specific purposes such as childcare or caring for an older person. And when we do meet people from other households outdoors or at a cafe, the maximum group size is 6 from a maximum of 2 households. In addition, avoid car sharing unless it is absolutely essential, and work from home if you can. And download the Protect Scotland app if you haven't already done so. And finally, remember facts, the 5 rules which will help to remind you how to do the right thing. Face coverings, avoid crowded places, clean hands and hard surfaces, keep 2 metres away from other households, and self-isolate and book a test if you have symptoms. By following these rules, we can all help to keep the virus under control, we can protect ourselves and our communities, we can support our National Health Service, and we can save lives. So thank you once again to everyone who is doing exactly that. And I'll hand over to Fiona Hyslop.
Thank you, Deputy First Minister. The impacts of COVID-19 continue to be felt across all areas of our society, and this month's brief from the Chief Economist, which is published today, lays bare the challenges for the economy as we move forward with our response. The report demonstrates that the path of recovery continues to differ by sectors, and we know that local restrictions are influencing the level of economic activity in some areas. In addition, the latest monthly GDP data shows that while the Scottish economy grew for the 4th consecutive month in August and has recovered around 60% of the output lost during March and April, the pace of growth has slowed in August, as it did in the rest of the UK as a whole. The Scottish Government is responding to these challenges in a targeted way and striving to find a balance between protecting public health and supporting the economy to protect businesses and livelihoods. And I know the difficulty and frustration that can inevitably come with further restrictions, but those short-term sacrifices will ensure we will be in a better position in the long term. We also value the efforts that businesses and other stakeholders are making, both to improve compliance and to work with us to develop our plans, and we will continue to engage with them. And I want to thank all businesses that have engaged with us in recent weeks and months. Their input has been invaluable. Next week, we'll see the introduction of the new strategic framework to help suppress the virus. This is accompanied by a refreshed programme of support for businesses from the 2nd of November, with grants of £2,000 or £3,000, depending on the business's rateable value, where they are required to close by law. That's payable every 4 weeks in arrears for the duration of the restrictions. We recognise that it's not only businesses that are required to close that will be impacted by the new restrictions. So there is also a hardship grant of £1,400 or £2,100 for businesses that remain open but are required by the regulations to limit the hours they can open or specify limitations on their operations. And I'd like to thank local authorities for administering these grant schemes. I know they're working hard to transition to these arrangements and make preparations for online applications. And I want to stress that if restrictions apply for more than 4 weeks, eligible businesses will not need to reapply. Earlier this month, we announced a £40 million fund to support businesses currently facing closure or hardship. Some sporting businesses and clubs have asked for explicit confirmation that they are eligible, and today I am pleased to confirm that we will be paying hardship grants in the Central Belt to sports clubs, gyms and swimming pools that operate from their own non-domestic premises and are no longer able to run or charge for group exercise classes, and that is the key test. I can also confirm that hardship grants outside the Central Belt and closure grants inside the Central Belt will be paid to bowling and other sports clubhouses which are licensed to serve alcohol and therefore equivalent to bars that must close or modify their operations. And in addition, we're extending the eligibility criteria for the support for nightclubs announced earlier this week to provide all nightclubs within the agreed definition with full funding, regardless of whether they adapted their premises and opened in a limited way for any period. It is also essential to protect people's incomes during this period. And today I am calling on the UK Government to ensure the lowest paid furloughed workers are properly supported through the new job support scheme. This new scheme, which we welcome, comes into effect on the 1st of November. It's better than furlough ending entirely, but I am concerned that it does not go far enough, especially for those workers in tourism, hospitality and the arts. In fact, it could cut the income of many of those affected to below the living wage. The reality this winter is that many furloughed workers will fall below the real living wage and face increasing hardship. And while top-ups may be available through universal credit, the 5-week waiting period for new claimants often leads to financial and psychological distress. The UK Government must ensure that the lowest paid workers are properly supported, including looking again at the rate of furlough pay for these workers. This could reflect the approach taken by other countries, such as France, where those on the minimum wage already receive 100% salary protection. So as we move into the new framework next week, I want to again recognise the sacrifices that businesses have made during this period. By continuing to work together to suppress the virus, we can come through this to the other side with a fair, sustainable, wellbeing economy that will benefit all of us.
Thank you very much, Fiona. The Economy Secretary, National Clinical Director Jason Leitch and I will now answer some questions from journalists, and we'll move straight to that. So can I come first of all to Ben Phillip from the BBC? Ben.
Thank you, Deputy First Minister. The co-leaders of Aberdeen City Council have accused the Scottish Government of central belt bias, with Aberdeen appearing to meet the criteria for level 1, but being placed in level 2, and both North and South Lanarkshire meeting level 4 criteria, but being placed in level 3. Can you appreciate why this might be frustrating for people and businesses in the North East? And I suppose, why publish the criteria when it appears to have been ignored? And a question for Jason Leitch, if I may. Can you please provide any further clarity around level 2 serving of alcohol indoors with a main meal? Questions are being raised about how this will work. Does everybody in the group need to order a main meal, and can people order alcohol before and after they eat? I think there's just some questions and clarity needed around that.
Okay, thanks very much, Ben. I'll ask Jason to respond to the second part of your question. Let me deal with the points raised by Aberdeen City Council and business leaders in the North East of Scotland, and the Economy Secretary may also want to add to what I say. The first thing I want to say is that I recognise entirely that there is frustration about the restrictions that are in place, not just in the North East of Scotland, but in all parts of the country. None of us want to be living our lives the way we're having to live them just now. But we are having to take steps to ensure that we act promptly and effectively and with urgency to tackle the pandemic. And we can see, as we look around the globe, the acute threat that many societies are facing. The full national lockdown that President Macron announced in France just a couple of days ago demonstrates the severity of the threat that is out there unless we take urgent action. Now, what the Scottish Government has opted to do in the first iteration of the application of the levels in our strategic framework is to err on the side of caution. Wherever we felt there were decisions that could have gone one way or the other about levels, we have erred on the side of caution to give us just that extra bit of time and space to try to get the virus under control. And that's very much the sentiment that has been applied in all circumstances around the country. So to the North East of Scotland, what I would say is that we have taken decisions that are based on the evidence in front of us. It shows that there is still a presence and a prevalence of the virus within our communities. We have to act and to exercise caution to suppress the virus, and we will do that in the forthcoming period. But I would also say that the government has given a commitment, and we will follow this up, that the allocation of local authorities to individual levels will be reviewed on a weekly basis. We will do the first review and announce its conclusions a week on Tuesday, and those changes will then come into effect a fortnight today, if there are any changes arising from those circumstances. So I would ask people in the country whether that's in the North East or anywhere else, to work with us and to understand that we are exercising caution to try to take these issues forward. Fiona, do you want to add?
On the issue around hospitality, we'll be issuing guidance later today, and my message to Aberdeen is we want to work with you. We have done through this, and particularly in August, and almost 2 weeks ago we agreed that Aberdeen Council will be able to increase the business support that was available for those businesses that were affected either directly by closure or indeed had to have an impact because of closure, some parts of that. So we will work well with Aberdeen. I'm sure Aberdeen want to do that with us. I think the people of Aberdeen will expect cooperation, and I'm looking forward to continuing that with Aberdeen Council.
Thank you, Deputy First Minister. The criteria point is, I think, important to say that the public health advisors didn't set strict criteria that if you pass or fail, our advice will be to be in a tier. It has to be a much more rounded conversation and consideration than that, including the local public health director in NHS Grampian for the Aberdeen example, in Lanarkshire for the Lanarkshire example. We have to take their advice along with the data, along with a whole host of other advice before we feed that to the politicians who will make those decisions. Just in today's data, Grampian has 30 positive cases. Fife, also in level 2, has 39. Dumfries and Galloway, also in level 2, has 17. We shouldn't take single days as the reason for a tier, but Grampian still has a number of infected individuals, and we believe, in our advice, that level 2 was the appropriate place to put them in a completely apolitical sense. As to the hospitality main meal instructions, I think the first point to say is that guidance, specific guidance, will be released today, as the Cabinet Secretary says, that will answer some of those questions in more detail. My more general point is I think the country knows what a main meal is. It's not a packet of crisps. It's not a single sausage roll. It's a meal. And I think we should ask people to use their common sense. What we're trying to do here is reduce social interaction, and where it has to happen, keep it as safe as you can. So I think the population and the restaurants know what a main meal looks like.
Okay, thanks very much, Jason. Can I come to Gordon Cree now from STV? Gordon.
Thank you. Can I ask both yourself and Professor Leitch, it's now a good number of weeks since the tighter restrictions were put in place in Glasgow and the west of Scotland. It's obviously been a few weeks since pubs were closed across the central belt, but still the infection rates are relatively high in those areas. Can you help me with any information you have about where people are getting the virus in those areas? And does it follow from that is as a result of not complying with the rules? And if that is the case, how much confidence can you have that the tier system we're going into will actually make any difference?
Thanks, Gordon. Let me say a few things, and then I'll pass over to Jason. The first is that I think if we turn the clock back to about a month ago when the restrictions came into place and ran a prediction of where we thought case numbers would be heading if we had not applied those restrictions, we would be dealing with daily case numbers that would be significantly higher than the ones that we are seeing today. Now, what that says to me is that the public have complied significantly with the restrictions and have avoided a situation where we ended up with many, many more cases than the 1,281 that I've announced today. So the data and the predictions that were coming out a month ago would have suggested that we would have been back by this stage in the end of October at something like the infectious levels that we had in March, and we are not at that position. So that says to me the restrictions have had an effect, but what the restrictions have not been able to do, and I think only full lockdown would be able to do this, and we saw this after March, is that the restrictions we've had have not been able to eliminate the virus in its entirety. It is still circulating. We are enabling people to be active to an extent. Our schools are open, there's hospitality services are available, people are working, shops are open, there's a whole variety of human interaction happening. So it is inevitable where there is human interaction that the virus will spread. I think the hopeful side of me today is that I think the virus is not spreading as significantly as we feared it would be had we not taken those restrictions. Now, that's an argument for two things. It's an argument for acting early, and we did act early. And the second thing, it's an argument for compliance and participation from the public. And I want to thank members of the public for their compliance to date, because that has undoubtedly led to a slower increase in the caseload. And I make a plea and appeal to the public to stick with the compliance to make sure that we can get the numbers down even further, and then we will be into a more steady position of being able to deal with the consequences of COVID within our society, whilst enabling other activities to take place at the same time. Jason.
I think you've covered it really well, Deputy First Minister. The data, Gordon, as I'm sure you're watching, is certainly decelerating in the Central Belt, but we haven't stopped all interaction. To be honest, every sector I speak to thinks the transmission isn't happening in their sector. It must be happening somewhere, and it must be happening where household meets household. So that can only happen in the few places where that's still going on. In people's households, in hospitality, in halls of residence, in universities and colleges, in school, etc., etc. And we haven't closed all of that down. In the last 7-day data I saw, there was still 1,000 people in Test and Protect who had been for some form of hospitality interaction. They may not have caught it there, but they were in that household interaction. So unless you close down completely, which you're seeing in some other countries, you cannot eradicate that household interaction completely, but that's what we need people to do. So as things are open, we need them to behave in such a way that the virus won't spread. But I am now increasingly confident that what we have done works. The problem is it just takes a while to work. And the people who are testing positive today may have caught the virus 2 weeks ago, remember, or at least 10 days ago. And they will get sick another 2 weeks from now. And then another 2 weeks from now, they may end up in intensive care. So the lag is really difficult to understand and really difficult to get a grip of when you're trying to restrict the country's freedoms.
And just one final point that I would add to what Jason said, Gordon, is this. The government wants to avoid a national lockdown, if at all possible. That's what we're trying to avoid. So the early action, the steady measures, the increased restrictions where they are appropriate and differentiated around the country is designed to essentially suppress the level of the virus as much as we can to avoid us taking the steps to a national lockdown, if we possibly can do. OK, can we move on now to Alan Smith from Bauer? Alan.
Thank you, Deputy First Minister. Just in regards to the guidance around travel and hotels, hotel owners have been telling Radio Clyde about their confusion over the travel advice, asking people not to travel to and from areas in higher levels. They've been seeking a bit of clarity on whether or not they should be accepting bookings from people who would be travelling from the higher levels. The Scottish Tourism Alliance says that businesses have a conscious responsibility to protect the communities they operate in. So can you provide hotel owners with a bit of guidance over whether or not they should be accepting bookings from people who would be travelling from areas in higher levels?
Our travel advice is set out in the framework, Alan, which will come into effect on Monday. And essentially, it says that if you are living in a level 3 local authority area or a level 4 local authority area, you should not leave that local authority area unless for some specified essential exemptions such as work or education or caring responsibilities. So there's a limited number of exemptions that enable people to leave level 3 or level 4 areas. We, of course, don't have any level 4 areas commencing Monday. But our strong advice to people is to stay within their local authority area if they are in a level 3 area. And then for people who are in level 1 or level 2, they are being asked not to visit level 3 or level 4 areas unless there is an exempted reason for doing so, whether that is access to education or work or essential shopping purposes. So there are specific exemptions, but essentially in the more acute areas, we're saying to people to stay within their local authority areas if they are in a level 3 or level 4 area. Can we move on to Neil Pooran from PA, please? Neil.
Thank you, Deputy First Minister. On the new rules around schools you've announced today, has any more consideration been given to the issue of ventilation in classrooms and getting the balance right between ensuring there's enough ventilation and ensuring the schools are warm enough for people to be there? And also, you say that blended learning and the option of learning from home is still an option that can be considered by the Scottish Government. I know the EIS Union have been calling for any areas that go into level 4 to start this straight away. Do you think that a school has to be in level 4 before you consider blended learning, or would you see any scenario where you could maybe introduce it sooner than that?
Okay, thanks very much, Neil. On the question of ventilation, the guidance covers some further detail on the issue of ventilation and makes a number of practical suggestions about how classrooms and school facilities can remain well ventilated whilst also protecting the health and well-being of staff and pupils, particularly as we go through the winter period. And the list of suggestions obviously reflects the range of different configurations of school buildings that we have around about the country, but it suggests temporary periods of ventilation, providing for regular air circulation during break times, and various other suggestions of that type to make sure that schools can have appropriate options to ensure that classrooms and school spaces remain well ventilated throughout the school day. On the question of the issue of school closures and the move to blended learning, throughout the levels that we have set out, we have made it clear that there is no automatic move to blended learning depending on when a particular local authority area moves into a particular level. There is, however, always the provision that exists within existing law, which is that directors of public health and local authorities must work together about ensuring that it is safe for schools to be open. Now, obviously, we're operating in that context and that environment just now, but there has to be a local dialogue about the appropriateness of schools remaining open to ensure that there is always a safe environment for staff and for pupils at all times. Now, the guidance that we've set out today is designed to strengthen the provisions that are in place to ensure that at all levels our schools are safe. So the extra measures that I've set out today about face coverings are designed to do exactly that, and they build on existing recommendations and other mitigations that are suggested within the guidance. But our priority throughout is to make sure that schools are always safe at all levels for all staff and pupils, and the guidance provides an opportunity to encourage and motivate schools to revisit some of those arrangements to make sure that remains the case. Now, obviously, if there is a need for schools to close or for classes to work from home because of self-isolation, and there have been a number of examples of that so far, the availability of digital and blended learning is there for all pupils to make sure their education is not interrupted as a consequence of those periods. Okay, we'll move on now to Rachel Watson of the Daily Mail. Rachel.
Thank you. I just wanted to ask again about the guidance for schools. First of all, the guidance for parents pick up and drop off, will that mean on the site, or those who are just around the school gates, for example, as well, who aren't actually on school property? Also, what disciplinary measures will schools be able to use for pupils who don't wear masks or who refuse to wear them in the classroom? Should those children be disciplined? And also, there's been a little bit of criticism online that this wasn't announced in Parliament for MSPs to be able to scrutinise the decisions. Why wasn't this decision made earlier in the week?
Okay, on the 3 points there, in relation to face coverings, and I draw here on one of the points that Jason made earlier on. The virus spreads through human contact and interaction. And obviously, when children have been picked up from school, particularly primary schools and early learning centres, there can be quite a bit of a congestion of adults picking up their children at particular and limited periods of time. And essentially, that's an opportunity for the virus to spread where there is human interaction. So whether parents are inside the fence of a school or outside the fence in the street, the guidance, the recommendation would be for parents to wear face coverings when they're picking up their children, so that we minimise the opportunity for the virus to spread. So that's a guidance to ask parents to respect that, to minimise the spread of the virus. Now, on the question of pupils wearing face coverings, we introduced this provision at the end of August. And we introduced it literally overnight and a couple of weeks after schools had gone back. And the feedback that I've had from head teachers in the secondary school sector is that pupils have complied magnificently with those requirements. So I think young people realise the seriousness of the situation that we face with the pandemic, and they've been willing participants in making sure that the arrangements are put in place for them to be safe, for staff to be safe, for schools to be safe. So I think there's a number of approaches that will be taken by individual schools to support young people to make sure they can wear face coverings. Some of them, there may be a financial issue, and schools will help out in that respect. But one thing that we've made very clear throughout the approach on face coverings is that we do not want to see pupils excluded from school because of issues that they have with wearing face coverings. Because inclusion of young people in education is absolutely vital to ensuring that their human right to education is fulfilled, and I believe that's an essential requirement of our education system. And lastly, on the question of whether the details should have been announced to Parliament, obviously I'm always ready and willing to discuss any issues with Parliament. We've shared a vast amount of material with Parliament in the course of the last week or so. The fundamental contents of the guidance that are being set out today are the same as they were before we announced them today. These are some minor changes that we are making to the arrangements, and obviously we'll be happy to discuss those with Parliament in due course. Can we move on now to Conor Matchett of the Scotsman? Conor.
Thank you, Deputy First Minister. Two questions, if possible. One for you, Professor Leitch. I have had a quick read of the evidence paper, which is backing up the move to face coverings. I'm wondering if you can explain, given there's no mention of face coverings in that evidence paper, the kind of decision-making process from a public health point of view of the transmission levels in schools and between children and the introduction of face coverings. And Deputy First Minister, if I may as well, it's been almost a month now since you announced the cancellation of National Fives. Wondering if you could update us on the contingency plans for 2021. And you also might remember that I think it was last week you were accused of a cover-up due to minutes from meetings between yourself and the SQA not being taken. Wondering if you could explain why minutes from those, I think, 8 meetings between you and the SQA about the alternative certification model weren't taken. Okay, let me take those issues first, and then I'll come to Jason Leitch. On the issues around the exams, I took a decision which was announced just before the October parliamentary recess, which was to ensure that there was clarity about the approach to the exam system and to make sure our exam diet next year could be as sustainable as possible. That involves the change of National 5 certification from an end-of-year exam to continuous assessment and validation during the year. The SQA is setting out the materials that it would recommend that schools should work with pupils to fulfil, to assist in supporting the judgments that are made about the educational performance of young people, and those involve setting of particular course assignments and making material available subject by subject, and that will all be available to schools in due course, and some of that is going to be available very shortly to enable schools to get on with some of the starting of that assessment work. So that contingency planning is all underway. We obviously are looking at the contingency plans which would have a similar character to the higher examinations that we intend, higher and advanced higher examinations that we intend to sustain in 2021,
and there'll be further details set out to schools on that basis. In relation to my dialogue with the SQA, the government's set out a vast amount of information about the dialogue that we've had with the SQA, including the appearances that both the Chief Executive of the SQA and myself have made at the Education and Skills Committee. Those discussions set out very clearly the parameters of the dialogue that existed around about the alternative certification methodology and model, the details of which were shared with me the Thursday before the exam results were announced in early August, and all of that information has been set out in the public domain. When it comes to the taking of minutes in various meetings, there are some situations where there are presentations of information set out for which there is no real value in setting out a minute, and the government makes judgments about which are the appropriate settings for those discussions to take place. Can I now I'll come to Jason Leitch to deal with the issue of face coverings.
So, Conor, I think you understand the evidence structures, the layers of that relatively well. We talk about it here a lot. We have a scientific advisory group that gives us general advice on the pandemic, which takes into account SAGE, NERV-TAG, SPI-M, all these other acronym UK-wide advisory groups. And then we have a specific group for education, which is, of course, education heavy, and some public health advisors. And then one of the Deputy Chief Medical Officers sits on that for us. And two pieces of evidence come together, and knowledge that has gathered in the last 9 months to get to the point of today's guidance. And that is transmissibility in kids. So we know that older children transmit the virus more easily than younger children, for instance. We didn't fully understand that in February and March. And the efficacy or otherwise of face coverings. And face coverings are not magic. They don't stop you getting the virus, but they reduce your risk, and they reduce your risk of passing it on. So those two things come together in the general kind of compromise advice that we're now giving around children, particularly that older age, and adults in the schools.
Okay, thanks very much, Jason. We'll now move on to Simon Johnson of the Telegraph. Simon.
Good afternoon, Deputy First Minister. I just wanted to follow up on a couple of questions that you've been asked this afternoon. In response to the BBC, you said that where there was a sort of marginal decision, you tended to err on the side of caution, but you didn't do that with North and South Lanarkshire. You went for level 3 rather than level 4. And also, you didn't do that with your home area of Perth and Kinross. There were 2 other areas, Inverclyde and Scottish borders, that were put in a higher tier because of their interconnectivity with other neighbouring areas. But Perth and Kinross was put in a lower area despite its interconnectivity with Dundee. And secondly, I'd like to just follow up on Alan Smith's question from Bauer. You set out with great clarity in your answer the travel advice that's coming in on Monday. But unless I missed it, I don't think you answered his question as to whether people, hotel owners, bed and breakfast owners who are in level 1 or 2 tier areas should be accepting bookings from people who maybe decided to, for whatever reason, to ignore the travel advice and travel outside a tier 3 area.
Okay, thanks very much, Simon. In relation to the judgments made local authority by local authority area, the government makes these decisions collectively based on the public health advice. And if we look at the various recommendations that came from the public health community, those were the recommendations that the government ultimately followed. So on the North Lanarkshire and South Lanarkshire cases, although it was marginal, the public health advice was for level 3. In relation to Dundee and Perth and Kinross, the Dundee recommendation was 3, the Perth and Kinross recommendation was 2. So the government looked at all of those recommendations, looking at the various factors that would be relevant. Now, if you look, and obviously I do know the details of the Perth and Kinross information intimately, it's the area that I represent. The challenges in the Perth and Kinross area were largely located around the boundary of the city of Dundee, areas such as Invergowrie, for example, which is just on the outskirts of Dundee. But Perth and Kinross represents a really vast geography that goes way inland to Rannoch and to Highland Perthshire. There's a sensitive judgment about geography that obviously has to be borne in mind about some of these factors into the bargain. But if you go back to what the First Minister said in Parliament yesterday, her guidance and her advice to people in the Perth and Kinross and Angus areas, for example, was to take extra care because of their proximity to an area of high intensity of the virus. So we make these judgments which take into account, yes, the data, but also some of the other more subtle factors that we have to reflect on. Now, in relation to the travel issue, I think the question that Alan asked me earlier on used language from the Scottish Tourism Alliance, which was essentially that hoteliers wanted to, I paraphrase, do the right thing, to act properly. I suppose in that spirit, I would have to say to hoteliers to discourage them from accepting bookings from areas that are level 3 or likely to be level 3. I think I have to give that advice because that would be the consistent point based on the travel advice that we're giving to level 3 residents, which is to say don't leave your local authority area if that's designated as as level 3. So I think that's the clarity that follows from the travel advice that we're giving. Okay, can we move on now to Ben Archibald of The Sun? Ben.
Thank you, Deputy First Minister. I had a question for yourself, Mr Swinney, and Professor Leitch. So, well-known chef Tom Kitchen had shared a message that he'd sent online to Nicola Sturgeon suggesting that the current restrictions stopping alcohol sales in restaurants are catastrophic for the industry and that that money is vital to pay staff and suppliers. It was partly to see what your views were on that and also whether there was any possible movement that could happen to maybe even allow higher level restaurants to serve minimal alcohol, like a glass of wine with dinner or something like that.
Okay, thanks, Ben. I'll invite Fiona Hyslop, the Economy Secretary, to say a little about some of the financial support that's available, because we recognise this is difficult for the hospitality sector and there are limitations in place, and I'll also invite Jason to comment. What I would say in general is that what the government is trying to do is to strike a balance between applying restrictions and creating sufficient opportunities for different sectors to be able to operate whilst we navigate our way through a difficult situation. So in the information that we set out this week, we expanded the opportunities for various hospitality businesses to be able to operate, albeit I accept, to a limited extent. So we removed the distinctions between different forms of hospitality to enable a bit more activity to take place, where obviously there are strict requirements and restrictions that have got to be put in place. But what comes with that is also the financial support that we're putting in place to assist those businesses that are affected. And I'll invite Fiona Hyslop to say a little bit about that.
And that's why we have to look at the support that can be given to the sector. Now, remember, right through this period, we've had specific measures just for hospitality, indeed, types of funds that are not available elsewhere, because we know the importance of hospitality and tourism to Scotland's economy. We've also had a specialist tourism fund, particularly for some hotels in particular, that are absolutely anchor and key to employment in different areas. But in relation to alcohol and meals, the issues about public health and alcohol have been well set out in terms of people's behaviour. But in terms of support, that is why we're providing support for those businesses that are required to close, but also those that can remain open, however limited, and that can be in many of these levels without alcohol, to provide that support. You've also got the UK government scheme, which will start on the 1st of November, which has the closed option, but also the open option that will enable furloughing of staff if there needs to be some further restrictions. And that means that there can be limitations, and understand that businesses will want to work out how they can best do that to protect their staff. Because many people in hospitality, and particularly in restaurants, have excellent, skilled members of staff, and they want to retain them. And that is why we're saying that it's really important that the job support scheme gets it right to enable, what I think it's meant to do, this new one, is to enable businesses to cut hours, but not to cut jobs.
I would add briefly, Deputy First Minister, and I take Mr Kitchen's point. I genuinely do. I would love hospitality to be open as we remembered it. In fact, I'd like to go myself. But as I said earlier, every sector thinks the transmission isn't happening in their sector. So what you described as higher level restaurants tell me that the transmission is not happening there. So do the cafes. So does everything in between the higher level restaurant and the cafes. But it is happening somewhere. And alcohol is part of that challenge for the public health advice because it disinhibits you and you're less likely to follow the rules, for certain. Now, that doesn't mean two people in a corner is necessarily unsafe to those two people, but there's an equalities issue, a fairness issue across the whole sector about business support and the public health restrictions coming together to protect the population. And I hope they are only in place for as short a time as humanly possible, but it's the virus that is closing them.
Thanks, Jason. Can we move on now to Alistair Grant from the Herald? Alistair.
Hi there, thanks very much. Just to go back to the BBC's question on main meals, and I appreciate you said that guidance will be issued on this later today. But is the idea that under level 2 you can order a drink before and after a main meal as well as during it? You just have to be having the meal. You can't go in for a drink and a packet of crisps, as you said earlier. And will the guidance put a limit on the number of drinks ordered with a meal? Or is that up to the venue's judgment? And just a question as well for Professor Leitch. And sorry this has been addressed before and I've maybe missed it, but cinemas need to close under level 3, which means in Edinburgh and Glasgow, for example, they can open their cafes during the day and have folks sitting inside, but they can't open their screens and allow people to sit socially distanced while wearing masks, watching a film. I was just wondering what the reasoning or evidence behind that was.
Okay, let me try and make a start at the main meal question. I think in regulation it will specify that the meal might be expected to be served as the main midday or main evening meal. So there's a specification in the regulations of the nature and the character of the meal. What restaurants and cafes and other facilities have then got to essentially interpret is what's a reasonable way to implement that and to ensure that somebody turning up and having a drink and a packet of crisps would quite clearly fall foul of that particular requirement. So there is an onus on businesses to be following the spirit of the legislation, which is set out as clearly as we possibly can do as to what constitutes a main meal. Now, if we were to try to specify it in more detail, I think we might be in danger of getting down to sort of meat and two veg sort of criteria, if that's to take it to that degree of specification. So we've taken it as far as we can do, but what we would look to is for businesses to be able to essentially interpret the spirit of those requirements in how they take forward these steps. And I'll invite Jason Leitch to add some comments on.
The cinema question is really, really difficult, Alistair. You've stumbled across in the last two questions the two things I would like to be able to do most: meal out and go to the cinema. There are marginal decisions in these tiers. Of course, there are long discussions into the night, both as advisors and with the decision makers. But the Central Belt today has 500 cases in Glasgow, 258 in Lanarkshire, and 194 in Lothian. So some of those marginal decisions, I'm afraid, ended up with more closures than we would have liked to do, of course. And cinemas, I'm afraid, fell into that. There is no direct evidence that says Frank caught the virus here. That's so difficult to get, but it is indoors. It is necessarily not as ventilated as some other places. There are surfaces. So cinemas have always been a concern of ours. They have done everything right, so it's not a criticism of the sector, just like our hospitality restrictions are not a criticism of the hospitality sector. But I'm afraid that for now, those tiers, the marginal decision was to close cinemas at tier 3.
Okay, thanks, Jason. We'll now move to Andrew Lermonth of The National. Andrew.
Thanks, Deputy First Minister. Just under the updated schools guidance, it says that PE in school settings should only take place out of doors at level 4. Just to be clear, does that mean that from Monday, PE indoors can return for all primary and secondary pupils who are not in level 4? The guidance from the subgroup also recommends keeping the precautionary approach to no singing in schools. Can you explain why that is? Singing has returned to schools in England and Northern Ireland. Can you maybe give an indication of when it might return to schools here? Will we have carols this year? And for Professor Leitch, the evidence paper published at the start of the month said that without further intervention, the infection rate, that is all infected people, not simply those who've tested positive, would be around 20,000 a day by the end of October and could be as high as 35,000 a day by the end of November. Are you able to say what the rate is, the actual rate is now that we're at the end of October? Have we done enough to avoid that grim prediction for the end of next month?
Okay, thanks very much, Andrew. I'll take the first one and a bit of those questions, and then I'll get to Professor Leitch to talk a little bit about the singing. Hopefully he won't sing for us, but and then to look at your question in relation to the data. On PE, your interpretation is correct. Physical education can be restored indoors in primary and secondary schools in levels 1, 2 and 3. In relation to singing, and this is where I will say a little, and then it's very much a clinical view, the act of singing runs the risk of essentially of droplets being created, and with large numbers of people, which there potentially could be in the situation that you recount of, perhaps a school assembly or larger gathering where there's singing involved, that risk is heightened. So we are erring again on the side of caution to avoid large amounts of singing where there is a possibility for the spread of the infection as a consequence of that act. But Jason may have more to say about that.
There was a very good social media and media article yesterday doing the rounds. I think it's a Spanish newspaper called El Pai. I think it's it's certainly the Spanish-speaking world. And they had a very good graphic, an article about transmission, about how it works, or how we think it now works, which is different and will change again with the months to come. And fundamentally, it's droplet spread, this virus, but in poorly ventilated areas, the droplets stay in the air for longer than in a well-ventilated area. So it's not airborne outside. It's not flying around in the air in the street, but in rooms like the one I'm in just now, if I sang, which we're not going to do, then those droplets would hang in the air for longer and put people at risk. The longer you sing, the louder you sing, the more people who sing, the more droplets. And therefore, you have to try and restrict that as much as you can, particularly when the prevalence of the virus is at the level we've got just now. Let's be clear, we're still positive tests, 1,200 a day, 500 in Glasgow. So you have to be careful when the level of virus is at this stage. As to the numbers, I don't have the number you seek. The number I have in my head, which relates to the number you seek, is yes, we haven't gone to that number since the evidence paper on the 9th of October, for sure. And the number I saw yesterday was now we're at 1 in 140 in the country, reduced from 1 in 160 in the country. You'd have to perhaps do that maths to get to the number you seek, but we'll be happy to send you the number you asked for specifically. I just don't have it exactly to hand.
Okay, thanks very much, Jason. Mark McLaughlin now from The Times. Mark.
Good afternoon. Question for Jason. At the COVID-19 committee this week, you said that the reason that Inverclyde may be escaping the worst of the wave that as it had in the first wave was because there may have been some kind of population immunity built up, or there may be different behavioural factors this time round. Do we have any kind of antibody tests to back that up? And what's the general science on conferred immunity now? Are we more confident or less confident about it than we were at the start? And also not just antibodies, I've been hearing things about T cells and all sorts of other things that can protect you.
I was absolutely certain, Mark, you'd ask me about the Spanish mutation today, but you've asked me about immunity as a surprise. The most interesting article I've read in the last 2 days is the Northern Italy immunity article, which suggests there are high levels of at least temporary immunity in towns that had very big wave ones. Now, the challenge here is we don't know how long that lasts. So it'll be very interesting to follow areas like London, for instance, that had At some points, 20 to 25% of the population infected and antibody test proven infection, and Northern Italy that had 40, 50% in some towns. We know that that immunity will protect you to some level from coronaviruses. We don't know specifically about this one yet, so we've got to be very cautious. Inverclyde does look as though something is different there from wave 1, no question. Is that all about behaviour? Something about behaviour, something about some immunity, perhaps in 9-10% of the population? It may well be. The difficulty is we don't know if it runs out at the beginning of December. That's the challenge. So your behaviours can't change. That's why we don't emphasise it too much. And the answer to your specific question, I don't have specific antibody test data from Inverclyde, but there are pilots in place, prototypes in place to do much more surveillance around the whole of the UK, the Siren study, a number of other studies that are looking at that. But I am hopeful that it looks as though around the world, some population immunity does protect both those individuals, but of course also protects those around them.
Thanks very much, Jason.
Since you mentioned it,
I think we'll allow you to reflect on that question over the weekend, Mark, and I'm sure you can pose it next week. Could I come finally to Kenny McBride of Broadcasting Scotland, please?
Thank you, Deputy First Minister. A couple of questions on testing, if you don't mind. Why are people who are asked to self-isolate through Test and Protect not routinely tested? If we know that someone may have been exposed to the virus, doesn't it make sense to test them and then potentially isolate their contacts as well? And also on testing, what work is in process to expand testing into the wider community in the way that Commonweal and others have suggested, particularly in the areas that are on the higher tiers of restrictions?
Okay, Jason, do you want to approach some of these now, and I'll say a little bit at the end?
You can't find the incubating virus, that's why. You cannot find the virus in people who are incubating it. I know it's so difficult, but you only find the virus once the person has symptoms and with decreasing efficacy in the 48 hours prior to them having symptoms. And then you also find it for about 7 days after they develop symptoms. So testing immediately contacts would give you a false sense of security because most of them would be negative and yet some of them would have the virus. So we wait for symptoms, but we don't wait for symptoms with them circulating, we wait for symptoms when they are self-isolating. So the population is protected, as is their family. Now, as testing improves, it may be that the test can get better at finding incubating virus rather than shedding virus. But for now, we simply cannot do it. We are testing in the round as much or more per head of population than the rest of Europe. We will do more asymptomatic testing in a prioritised way, as the testing strategy suggested, as more capacity comes online.
I think that last point that Jason makes is the one that I wanted to come back to, which is that obviously we've undertaken the review of the testing strategy. There will be further steps taken to expand asymptomatic testing. Obviously, there are priorities that have to be applied as to where that is appropriate to use and when that is the case, and that discussion is very much an ongoing priority for government to take forward. So that's all the questions today. Can I thank everybody for tuning in to take part in this discussion today? Can I close by reminding everybody about the advice about downloading the Protect Scotland app, about following facts, about wearing face coverings, avoiding crowded places, cleaning hands and hard surfaces, keeping 2 metres away from other households, self-isolating and booking a test if you have symptoms? Can I encourage everybody to comply with these requirements and all of the other restrictions, and remind everybody that at 6 o'clock on Monday morning, the new level and tier system comes into operation, and the restrictions that are required under each of those scenarios will apply in local authority areas. And we would encourage everybody to familiarise yourself with all of that information which is available on the government's website. Can I thank our BSL interpreter Rachel for her support today? Can I thank the Economy Secretary Fiona Hyslop and Jason Leitch for being with me today? And can I wish everybody well for the weekend? It's Halloween. Please enjoy, but please stay at home and please stay safe. Thank you very much.